So ADHD is usually diagnosed by either a psychologist, a paediatrician or a psychiatrist, and it would normally follow a comprehensive assessment. So it would be meeting with one of those people and getting a history of the types of difficulties that they've been having, looking at their inattention, impulsivity, hyperactivity, looking at what difficulties those create for different people. And a big part of the assessment is kind of other things that can look like ADHD, and either including them or excluding them, things like head injuries or substance use issues or other things. And generally people will ask about family history and try and place the presentation in the context of what's known within the family. And then some observation in clinic, although we don't tend to rely very strongly on that because people can present quite differently in a new clinic with a novel person than they do in the ordinary world. And we would ordinarily get some rating scales from relevant people. So for young kids, that would be their parents and teacher. For older people, it could include themselves. Frequently, teenagers or adults will give information about themselves, or sometimes an employer or an extended relative, somebody like that. So you put all that information together and come up with what you think's your best diagnosis. It can be, and diagnoses can change over time. So we used to think that ADHD was present at 6, 7 and then may continue or might not continue, but later studies are suggesting that people can present much later in life, and that what didn't reach threshold earlier may then reach threshold when the demands are greater. So people might get through primary school and intermediate but may struggle at high school with lots of teachers and more demands, or other people might struggle when they're at university when there's less scaffolding and those things. And sometimes it does become apparent that what you thought was your most likely diagnosis wasn't the best explanation. So sometimes over time, autism spectrum disorders may become more apparent as you get to know the person and start to understand more about them. So things can change a little bit. And sometimes other conditions become more prominent. Anxiety, for instance, may be less prominent at 6, 7, but might be very prominent at 13. So people aren't static, and you do need to be able to adjust and keep your formulation, your summary about them open a little bit. So ADHD is a relatively stable condition from sort of 6 on. Before 6, it's pretty unstable, so we tend not to make a diagnosis before that unless things are really severe. So ADHD only really occurs by itself. It's usually associated with something else, frequently 2 or more conditions in 50% of people. And the most common conditions in childhood tend to be oppositional defiant disorder, which has been stubborn, argumentative, irritable, or associated learning issues, so dyslexia, difficulties with maths, dyspraxia, those types of conditions. So they're very, very frequently present in a third to a half of cases. And then some other conditions are overrepresented, so anxiety and mood disorders, particularly depression. Increasingly, people are talking about neurodiversity, so they're including within that ADHD, autism, sometimes a range of learning issues, occasionally Tourette's and other things. And those conditions are very frequently clustered together, so that people with autism, around 40 to 50% of the time, will have ADHD, and that's frequently missed and should be looked for. And then as you get older, other conditions start to come on stream. So people with ADHD are more likely than people without ADHD to develop substance use issues and smoke cigarettes or vape. More likely to engage in other substance use, illegal substance use, over time, and adults can have quite complicated presentations with low self-esteem and depression and lots of things going on at the same time. It can be quite hard to disentangle all the components. So ADHD for many people continues to be an issue for them as they grow up. By teenage time, around a third of people with ADHD have matured out of it or grown out of it. And we can't really tell at the start which people those will be. It's really determining how they do during follow-up. DSM-5 estimates that 2.5% of the adult population have ADHD and 5% of children and adolescents have ADHD. So they expect that for around half of people by adulthood, ADHD is not significant enough to cause impairment. Difficulties with attention span tend to be more persistent, so concentration, organisation, forgetfulness, those symptoms are more persistent than hyperactivity and impulsivity, which often improve.